Imagine walking into the doctor's office. You sit down, you smile politely, you wait for your turn. The nurse calls your name. You walk in, sit on that cold chair, and suddenly, without realizing it, your voice becomes softer, your words shorter, and your questions fewer. You say things like, "I guess it's just old age," or "It's nothing serious, doctor, just a little ache." You think you're being polite. But what if I told you that these quiet, harmless words are slowly stealing the care you deserve? What if this habit of speaking too little, too humbly, is one of the biggest mistakes seniors make after 70? Most people don't notice it, but something changes after we cross that milestone age. We begin to shrink our problems before others do. We start believing that pain is normal, that forgetting names is natural, that feeling tired is simply what happens when you grow older. And so when you finally go to the doctor, instead of saying what's truly happening, you hide it behind phrases like, "I'm fine," or "It's not a big deal." The truth is, 95% of seniors talk this way. And it quietly kills the honesty that could save their life. Doctors are not magicians. They rely on your words, your details, your honesty to understand what's happening inside your body. When you soften your story, they see only half the picture. A study from the National Institute on Aging found that seniors often underreport symptoms because they fear being seen as complainers. Yet the same study revealed that those who spoke openly about their pain receive earlier diagnoses and more effective treatment. Silence doesn't make you stronger. It only makes your illnesses louder when it's too late. The first truth every senior must understand is that doctors can only help as much as you let them. If you tell them, "I just get dizzy sometimes," they'll note it down and move on. But if you say, "I get dizzy every morning after standing up, and it's been happening for 3 months," they start connecting the dots. That detail could reveal something serious, like low blood pressure, inner ear issues, or even early signs of nerve problems. One simple sentence could be the difference between prevention and regret. So never shrink your story. Tell the whole truth, even if it feels small or embarrassing. The second truth is that age is not a disease, but too many seniors talk as if it is. When the doctor asks how you're feeling, and you reply, "Well, I'm 75, what do you expect?" You are unconsciously teaching your doctor not to dig deeper. You're saying, "Don't bother looking for an answer." According to research published in the Journal of the American Geriatric Society, doctors tend to overlook treatable conditions in seniors who attribute their symptoms to aging. That means your tiredness, joint pain, or sleep trouble might have a fix, but you'll never know if you keep blaming your age. Growing old doesn't mean giving up your right to feel good. There's always something that can be improved, managed, or healed. So when you visit your doctor, talk with hope, not surrender. Instead of saying, "I guess this is just part of getting old," try saying, "I've been feeling weaker lately." What could be causing that? That one shift in tone tells your doctor you want answers, not sympathy. It turns the conversation from acceptance into action. The third truth is that you must never hide your medications, supplements, or home remedies. Many seniors, out of fear or habit, don't tell their doctors what else they're taking. They think, "It's just an herbal capsule," or "I've been taking this for years." But this small silence can create serious danger. The Mayo Clinic reported that over 30% of hospitalizations among seniors are linked to medication interactions. Sometimes it's not the medicine itself, but the combination of two things your doctor doesn't know about that creates harm. So when your doctor asks what you're taking, list everything, every pill, every vitamin, every powder, even the tea you drink for sleep. You might feel it's unnecessary, but it's one of the most important conversations you can have. It could prevent side effects, dizziness, or even heart rhythm issues. Remember, Your doctor is not there to judge your choices. They're there to keep you safe, but they can only protect you if they know the full story. The fourth truth is that you should never downplay pain or discomfort. Pain is the language of your body. When you say, "It's just a small pain, I can live with it," what you're really doing is ignoring your body's voice. A 2020 Harvard Medical School study showed that seniors who ignored chronic pain were twice as likely to develop mobility problems within 2 years. Why? Because untreated pain changes the way your body moves, rests, and heals. It slowly becomes a chain reaction that affects everything from your sleep to your heart rate. If something hurts, say it clearly. Describe it like a story. When did it start? What makes it worse? How long does it last? The more specific you are, the easier it becomes for your doctor to help you. And don't worry about sounding dramatic. Doctors need details, not bravery. Your courage lies in your honesty, not your silence. The fifth truth is perhaps the hardest one. Stop pretending to understand when you don't. So many seniors nod their heads in the doctor's office, pretending to follow every word. The doctor says, "You have mild cognitive decline," and you nod politely. Or they mention your blood pressure range, and you say, "Okay, I'll take the tablets." But inside, you're not fully sure what any of it means. That's dangerous. Confusion leads to mistakes. A study from the Annals of Family Medicine found that nearly half of older adults misinterpret their prescriptions because they hesitate to ask for clarification. That means half of seniors are taking their medicines incorrectly simply because they didn't feel comfortable asking questions. If something doesn't make sense, ask again. Ask slowly, clearly, and without apology. Say, "Doctor, can you explain that again in simpler words?" Or, "Can you show me how to take it properly?" A good doctor will always respect your honesty, and if they don't, you deserve a better one. Knowledge is power, and at 70 or 80, power comes from clarity. There's another quiet truth behind all of this. The way you talk to your doctor reflects the way you see yourself. When you walk in timid, apologetic, or unsure, you send a message that your health is less important. But when you walk in confident, curious, and open, you remind everyone, including yourself, that your life still matters deeply. Every question you ask is proof that you care about your future. Every detail you share is an act of self-respect. Think about it this way. You spent your whole life caring for others. You raised children, worked long hours, faced hardships, and built a life from scratch. Now, this stage of life is not about endurance. It's about attention. Paying attention to your body, your feelings, and your words. Speaking to your doctor honestly is one of the kindest things you can do for yourself. Because the truth you share today might prevent the pain you would face tomorrow. Let's be honest. Many seniors feel that doctors don't really listen anymore, that appointments are rushed, that nobody has time. But that's exactly why your words must count. When you use your few minutes wisely, by being specific, honest, and direct, you change the outcome. You help your doctor help you. Here's a small example. 2 patients walk in. Both have chest tightness. The first one says, "Doctor, it's nothing serious, just a little pressure sometimes." The doctor notes it down, assumes mild anxiety, and moves on. The second one says, "Doctor, I've been feeling tightness in my chest every night for the past 2 weeks, especially after walking upstairs." It lasts about 5 minutes. The same symptom, 2 different stories, but only one will get tested for possible heart issues. That's how powerful your words are. Communication is medicine. A study from Johns Hopkins University confirmed that patients who communicate openly have better recovery rates, fewer hospitalizations, and higher satisfaction with their care. Not because their doctors are more skilled, but because their relationships are built on truth and clarity. Your doctor is your partner, not your boss. The conversation should be equal. So, next time you sit in that white room, don't start with, "I'm fine." Start with what's real. Say, "I've been feeling more tired lately." Or, "I've been forgetting things." Or, even, "I don't feel like myself." These sentences might feel small, but they are doorways to bigger understanding. The more open you are, the more accurate your care will be. And when you leave, make sure you fully understand what was said. Repeat the instructions aloud. Write them down. Ask for a printout. Studies from the CDC show that when seniors repeat instructions back to their doctors, comprehension improves by over 80%. That means fewer mistakes and better results. The truth is, aging doesn't take away your power. Silence does. Every time you walk out of that clinic without speaking your truth, you lose a little piece of control. But every time you speak up, you take it back. You reclaim your role as the main character in your own story. So don't be polite when it comes to your health. Be precise. Be real. If you're scared, say so. If something feels wrong, don't wait for it to get worse. If you don't understand, ask again. If you feel rushed, speak slower. Your body has carried you for decades. It deserves your honesty now more than ever. Let's stop saying, "It's just my age." Let's stop pretending I'm fine when we're not. Let's stop using gentle words that protect others but harm ourselves. Because your life, your comfort, your peace, they are still worth fighting for. And the fight begins not in silence, but in speech. So, the next time you walk into your doctor's office, remember this. Speak like your health depends on it. Because it does. Speak like your story still matters. Because it does. Speak like you still have years worth protecting. Because you do. And when you do, something amazing happens. Your doctor begins to see not just an aging patient, but a living, breathing human being who still wants to understand, still wants to heal, still wants to live fully. That's how care transforms. Not through technology, not through medicine, but through words. Honest, human, fearless words that remind both you and your doctor that the conversation is not over. It's just beginning. Because in the end, everything comes down to the conversation. The one that happens between you and your doctor when you finally decide to speak your truth. That quiet exchange, often brushed off as routine, can quietly shape how long you live and how well those years unfold. The words you choose, the honesty you give, the courage you show, those small things can become the difference between a long, healthy life and a silent struggle that no one sees coming. Think about it. When you walk into that office and say, "I'm fine," you close the door to discovery. But when you say, "I don't feel like myself lately," you open that door just enough for your doctor to look inside. Those few extra words could uncover an early heart issue, hidden depression, or a small imbalance that can still be corrected. Research from Harvard Medical School shows that patients who communicate openly live not just longer, but better. They sleep more peacefully, they recover faster, they experience fewer hospital visits. Why? Because their doctors understand them fully. It's not just about the science, it's about trust. When your doctor knows you're honest, they listen differently. They start noticing the details between your words, the tone, the hesitation, the look in your eyes, and those small observations often lead to big discoveries. One study from Johns Hopkins University found that doctors are twice as likely to identify early warning signs of chronic disease when patients describe their symptoms in full sentences rather than short phrases. That means the way you talk could literally save your life. But here's the part most people forget. Your voice doesn't just guide your doctor, it also trains your body. When you start speaking with awareness and detail, you become more in tune with what's happening inside you. You notice when your breathing changes. You recognize when your heart feels heavier. You understand what your body is trying to tell you. And that awareness is a form of medicine in itself. People who stay connected to their own physical changes respond faster to treatment and recover more fully. You see, growing older doesn't mean growing quieter. It means growing wiser. And wisdom is knowing that silence doesn't protect you anymore. The truth does. Every sentence you share with your doctor is a bridge to better care. Every honest word is an act of self-preservation. So the next time you sit across from that white coat, remember this simple truth. You are not there to please anyone. You are there to protect your own time on this earth. Speak up. Ask questions. Describe everything. Don't hide behind politeness or fear. Because your doctor's understanding begins where your silence ends. And the moment you start speaking from truth, you don't just improve your treatment, you extend the very quality of your life. What if, all along, the secret to living longer wasn't hidden in medicine at all, but in the way you finally learned to talk about yourself?